Kim, can you hear me? We're testing the audio from our end. Yeah.
Hi, Kim. Could you test the audio with us really quickly? We just want to make sure it's clear for her from our end.
Hi, yes, I can hear you. If you would come down to my desk for a second, that would be great.
Perfect. Thank you.
Good afternoon, Dr. Frere.
Afternoon, how are you?
Doing great. Ready to do an excellent media briefing? Let me know when you're ready.
Well, I think we have another minute or so we'll just wait till 2 and then we can just get started.
Sounds great.
We can get started.
Wonderful. Good afternoon, everyone. Thank you for joining Los Angeles County Department of Public Health today, November 4th, for a media briefing. Today we have Dr. Frere, Director of the department, Before we get started, as a note, next week, due to the Veterans holiday on Thursday the 11th, we will be having next week's briefing on Friday the 12th. Dr. Frere, you may begin.
Thank you very much. And thank you everyone for joining me for today's briefing. This afternoon, I'll be presenting our metrics by vaccination status and racial and ethnic groups, provide an update on variants, and share information about school and youth sports cases and outbreaks. I'll also discuss our progress with equitably administering vaccines and boosters, provide some information on administering vaccines to children, and close with some reminders on what we can all do to celebrate Thanksgiving safely. I'll take the first slide. We are sad to report 12 additional deaths today. At least 9 of the people who passed away had underlying health conditions. This does bring the total number of deaths to 26,695 across the county. Our hearts are broken for everyone who's lost a loved one, a friend, or a coworker to this virus. And we share with you our hope for your healing and comfort. We're also reporting 1,829 new cases today. That brings the total number of cases in LA County to 1,498,393. The higher number of cases today reflects delays in reporting of 396 positive cases from one of our largest testing labs. These cases are associated with positive test results that occurred between October 18th and October 29th. We're also likely to see higher numbers in the future days because we know that there are some additional backlog tests that we still need to include in our case counts. To date, more than 9.1 million people have been tested and had test results reported in LA County. Our daily test positivity rate is now 1.6%, and this is an increase from last week's same day rate of 1.2%. Our daily average case rate with the 3-day lag is now 9.8 new cases per 100,000 people. This is also an increase from last week's case rate of 6.1 cases per 100,000 people. CDC estimates our weekly case rate is now 84 new cases per 100,000 residents, reflecting continued substantial transmission across the county. There are 662 people currently hospitalized with COVID-19, and this is an increase of 13 people over the past week. Currently, we have 122 open outbreak investigations at residential congregate settings and non-residential settings, with at least one confirmed case of COVID-19. This graph shows trends in cases, we can go to the next slide, sorry. This graph shows our trends in cases, hospitalizations, and deaths in the county from the very beginning of the pandemic through October 27th of this year. We're seeing a plateau across all of our metrics with signs of a possible uptick in transmission over the more recent days. We need to note that the additional 1,200 backlog cases from one lab, which occurred over the last week and a half in October, is going to affect our case numbers and rates for that last week in October, which are expected to rise once we assign all of the backlog cases to the appropriate episode date, and we'll see a corresponding small decrease in the cases we're reporting for this week. We saw no change in our daily average hospitalizations, which remained steady at about 630 hospitalizations. Deaths also continue to occur at the rate of about 7 to 8 people passing away each day. And CDC's assessment of our weekly case rate, which reflects the more recent numbers, suggests that we again, a slight increase here, seeing 84 new cases per 100,000 residents. This does continue to reflect substantial transmission across the county. Cooler weather has arrived, and with it, conditions that favor COVID transmission as we gather inside to stay warm and for celebrations and gatherings. While vaccinations remain our most powerful tool for reducing spread of the virus, when we have this much transmission, masking up indoors and in crowded outdoor spaces is still an important layer of protection for everyone. We ask that you continue to do your part and adhere to the masking requirements, which are likely to remain in place for the remainder of this calendar year as we all work hard to reduce community transmission rates to the moderate tier. This would mean that we would have less than 50 new weekly cases per 100,000 residents. To achieve this benchmark, daily new case numbers would need to fall to about 700 cases per day. Next slide. If there are any doubts about what's fueling our cycles of surges, you can see the most likely answer on this slide, which shows age-adjusted case rates in green, hospitalization rates in orange, outcomes in vaccinated people in solid lines, and outcomes among unvaccinated people in dotted lines. As you can see, both case and hospitalization rates remain flat amongst vaccinated people, but they're now ticking up amongst those who are not yet vaccinated. The differences between these groups remain stark, with unvaccinated people 7 times more likely to get infected and 27 times more likely to be hospitalized than vaccinated people. When community transmission is higher, we can expect that more vaccinated people will also develop infections, although always at a much lower rate than unvaccinated people. We can also expect that a small subset of these vaccinated individuals, likely to be the oldest and most medically fragile among them, will end up hospitalized, and unfortunately, some may even pass away. This is because unvaccinated people create risk for everyone. Vaccination cannot entirely immunize us against the consequences of the chances unvaccinated people take. Their risk eventually spills over into that for vaccinated residents, and it is leading all of us to continuing to take additional protections like masking to reduce the chances of getting and passing on the virus. This is why it remains important for us to reach out to people who have not yet been vaccinated and offer them whatever path to vaccination might work for them. Very often, that means calling people in rather than calling them out. All of us who have experienced the relief of being vaccinated can be part of the invitation that we as a society offer to those who remain unvaccinated. And we can do this by sharing information about vaccination or simply by sharing our own experiences of getting vaccinated and how much safer we feel now that we've gotten our vaccines. Bridging this gap is likely to take a little effort from a lot of us. Next slide. Gaps in outcomes between racial and ethnic groups countywide have persisted throughout the pandemic and are a consequence of inequities in access to the resources that promote good health. On this slide, you can see 30-day cumulative case rates in green, hospitalization rates in orange, and you can see these rates among Latinx, white, Black, and Asian residents across the county. Rates in vaccinated residents are shown in the solid bars, while rates among unvaccinated residents are shown in the crosshatched bars. Between September 24th and October 23rd, case rates were consistently 2 to 3 times higher for unvaccinated residents in every group compared to those who were vaccinated. The highest case rates were among unvaccinated Latinx residents, followed by white, Black, and Asian residents. Meanwhile, hospitalization rates were between 5 and 9 times higher among unvaccinated residents and were highest in Latinx and Black residents, followed by white and Asian residents. Next slide. This slide shows the age-adjusted death rates, with dotted lines representing outcomes in unvaccinated people and solid lines representing outcomes in vaccinated people. The death rate among vaccinated people remains nearly flat, as it has for many months, while deaths among unvaccinated people remain persistently elevated, and tragically, they're now ticking upward. By October 16th, the risk of death was 41 times higher among unvaccinated people than among those who had been vaccinated. Next slide. We also are looking at deaths among racial and ethnic groups, and we can see that the risk of death is significantly higher in all groups among unvaccinated people, again represented here in the crosshatched bars. Latinx and white residents had the highest mortality rates, followed by Black and Asian residents. Next slide. We continue to monitor outcomes among fully vaccinated people to better understand the level of protection vaccines provide and to track post-vaccination infections. Here, the numbers of cases, hospitalizations, and deaths among fully vaccinated people are visualized to scale. The large green box represents the nearly 5.9 million residents that are now fully vaccinated. The tiny purple box in the lower left corner of this green box represents the nearly 69,000 fully vaccinated people that now have tested positive for COVID as of November 2nd. In all, about 1.2% of fully vaccinated people in LA County have now tested positive. Of those who tested positive, about 2,300 people were hospitalized, and this translates to 0.04% of fully vaccinated people ending up hospitalized. There have been 379 deaths in this group, and that translates to 0.006% of fully vaccinated people passing away. The number today includes 15 deaths that occurred between March and September of this year in vaccinated individuals that we now presume to have been reinfected. In the past, these cases were not included because their deaths were not associated with a recent COVID infection. With the accepted definition that individuals with a positive test after 90 days of being infected are considered new cases, these 15 deaths have been reclassified as associated with COVID-19. Next slide. We do routinely receive and share information on COVID-19 variants, and we monitor trends in the locally circulating variants to help understand our local disease patterns and to give us an early warning if another variant of concern starts to increase in frequency. New variants, especially if they're shown to cause a different severity of disease or to spread differently in communities, may prompt us to adjust the recommendations we make to help residents keep themselves and their loved ones safe. This slide shows the change in frequency of variants identified amongst LA County residents as a percentage of all the sequences reported to public health between January of this year through October 23rd. The Delta variant, here represented in red, emerged in late May, and as you can see, it quickly dominated the scene. This variant still remains the predominant variant detected among our residents, now accounting for 100% of our cases. We'll continue to monitor the reports we receive for other variants being monitored, and we'll report that out to you on a regular basis. Next slide. We do all want to see children be able to continue attending in-person classes and participating in school-based activities. For that reason, we routinely monitor cases among both staff and students at schools to identify any emerging challenges. On this chart, the lines and shades of pink represent cases, while the lines and shades of green represent close contacts. Darker shades represent student data, while lighter shades represent staff data. As a reminder, because the numbers of student close contacts are so much higher than the other metrics on this slide, they're plotted on a different scale that you can see to the right of the slide. Last week, we saw 670 student cases and more than 3,100 student close contacts. Among staff, we saw about 110 cases and 250 close contacts. These case numbers represent a 26% decline in student cases and a 29% decline in staff cases from the prior week. The increase in staff close contacts is in part due to several outbreaks in which the exposure location was the staff break room. Our data still notes the same test positivity rate of 0.2% among students and staff that are tested, with about 0.2% identified as close contacts. These low numbers are the result of work our school communities have done to layer on protections that keep students and staff safe, and we're grateful for their collaboration on this effort. We do hope that these numbers will drop further as more and more children get vaccinated to protect themselves and their friends and families from COVID infection, but we do want to issue a note of caution that when community transmission goes up in the community, it also is likely to go up at our schools. Next slide. Although most TK through 12 cases are not associated with outbreaks, 3 or more cases linked to transmission at schools or school programs meet the definition of an outbreak. There were 9 outbreaks the week ending October 31st, 7 in elementary schools and 2 in middle schools. With more than 3,000 TK through 12 schools across our county, this remains a remarkably low number of outbreaks. We do expect that we'll continue to see outbreaks, but again, as more children become eligible for vaccination, we hope these numbers will decrease as well. Next slide. With the impressive protection offered by vaccines, we're thankful to the partners for administering nearly 13.4 million vaccine doses in communities across the county. As of October 31st, 94% of LA County residents 65 and over received at least one dose, as have 80% of residents 12 and over. 72% of residents 12 and over are fully vaccinated, and 73% of teens between the ages of 12 and 17 received at least one dose. Out of our nearly 10.3 million LA County residents, including those still not eligible for the vaccine, 69% received at least one dose, and 62% are now fully vaccinated. So far, nearly 610,000 additional or booster doses have been administered in LA County. Booster doses remain available to many people who received their second doses of Pfizer or Moderna vaccines at least 6 months ago, and to those who received a Johnson & Johnson vaccine at least 2 months ago. Next slide. The unfortunate news is that we're still seeing relatively low weekly numbers of first doses of vaccine administered across the county. As you can see on this chart, between October 25th and 31st, we administered slightly under 40,000 doses. This is a similar number to the prior week. While last week's numbers might rise a few thousand once all reporting is complete, and we're glad to see these numbers are not decreasing, this still does not represent the increase of first doses we need to have as we worry about another possible winter surge. As a reminder, vaccinated and unvaccinated individuals cannot afford to think of themselves as being on different sides here. We're all on the human side. And as a community, we share the goal of wanting to avoid another winter surge. So let's help each other do that. Next slide. We've been looking at which of our residents have received boosters or additional doses of vaccine to ensure that those most vulnerable are at the front of the line. On this slide, you'll see the number of fully vaccinated residents in each age group, as well as the number and percent of those who are fully vaccinated that have received a booster or additional dose. Looking at the rightmost column, we're glad to see that more than a quarter of our seniors 65 and older have received a booster or additional dose. And as you know, those were the first folks that were eligible to get vaccinated, so many of them are 6 months out from their second dose. We have 10% of adults aged 50 to 64 and 6% of adults aged 30 to 49 that also received booster doses. Please note that many residents represented here as part of the total population are not yet eligible for boosters, having been vaccinated more recently or being at relatively low risk for severe illness. Next slide. It's less reassuring to look at booster uptake by racial and ethnic groups. Here we see the greatest uptake of booster or additional doses has been among white residents, 16% who've received these doses, followed by Asian residents at 13%, and unfortunately trailed by Black residents at 9%, American Indian, Alaska Native residents at 8%, and Latinx residents at 6%. We suspect these differences are not accounted for by differences in eligibility, as much as they are by differences in understanding what the boosters do, who they're meant to protect, and where folks can go to get their booster dose. Next slide. Our vaccination sites aim to address some of these gaps in booster uptake by focusing on areas where the need and vulnerability are the highest. On this map, where you can see in our hard-hit communities are noted in pale green, you'll see the 834 fixed DPH and partner sites countywide where residents can get booster doses of all 3 vaccines, as well as their primary vaccine series. And at some sites, you can even get your flu vaccine. 44% of our fixed vaccination sites are located in our high-need communities. Next slide. We still have hundreds of mobile vaccination teams out every week, persisting in their efforts to fill in the gaps in those places where unvaccinated people live and work. And we can administer with our mobile teams first, second, and booster or additional doses of vaccine. As you can see on this map, there are 427 mobile unit site visits scheduled this week. And as always, we're focused on bringing vaccinations to community gathering places and workplaces, especially in our high-need areas. Almost all of these sites offer booster doses. And as a reminder, anyone can request a mobile team. You just need to go to our website, and we're happy to come to a community spot or a workplace. As a reminder, all you need to bring with you to your appointment if you want a booster dose is proof of your primary vaccine series. such as your white vaccination card, a photo of your vaccination card, a medical record that documents that you've received these vaccines, or your digital vaccine record. If you can't find that at most sites, we're happy to help look it up or take a self-attestation. Next slide. With vaccination of children ages 5 to 11 now rolling out nationwide and here in the county, I do want to set some context for this vaccination effort by sharing some of the data from Tuesday's meeting of the CDC's Advisory Committee for Immunization. This is the wrong slide, so I'm wondering if you can either back up or, nope, go forward one more. Yeah, let's use this slide. Sorry about that. I do want to set some context by sharing some of the data from Tuesday's meeting of the CDC's Advisory Committee for Immunization Practices. This slide shows the average number of annual U.S. pediatric deaths due to vaccine preventable diseases in the years preceding the rollout of vaccines created to prevent these diseases. As you can see, the burden of children's deaths due to these diseases was, at most, a third of the burden caused by COVID-19. In the years when these vaccinations were rolled out, those deaths were enough to cause us as a society to agree we needed vaccines to prevent these diseases. And this slide doesn't describe the additional burden of hospitalization and chronic illness due to these diseases, much less their horrific effects on children beyond US borders. What is made clear is that when the burden of pediatric disease is dangerous, and when the vaccine is safe and effective, we have historically agreed that the vaccine needs to be a routine part of children's preventive health. All of the vaccines on here are routine vaccines that are given to children. Next slide, which may be the slide. You may need to go back to the other slide. For some reason, they weren't in order. This one, perfect. For this reason, many parents were relieved earlier this week when the CDC endorsed the use of vaccine in children ages 5 to 11. There are many good reasons to vaccinate children in this age group. In addition to the fact that COVID infection can lead to hospitalization, death, inflammatory syndromes, and long-term symptoms in pediatric populations, children can transmit the virus at least as efficiently as adults. In a CDC study in Utah, 12 of the 110 children that were exposed to COVID in 2 childcare centers, 11% of those exposed, got infected. Those children transmitted infection to 12 adult household contacts, one of whom was hospitalized. Imagine that instead of 12 children, we're talking about the 900,000 of our 5 to 11-year-olds in this county. With the same attack rate, we'd see 98,000 children infected and the same number of adults infected. And we'd see 8,000 of those adults hospitalized. Of course, extrapolating in this way doesn't always represent reality, because there are other factors that we know affect transmission. But the role of children in transmitting infection is very real, and the waves of infection that can result if children are not protected are tragically also very real. Meanwhile, vaccination has shown to be 91% effective in preventing infection in this age group, with only mild side effects. Vaccinating children is an important step to protecting them, their households, and the communities in which they live. I know that many parents and caregivers still have lots of questions about vaccinating their children, and we hope you'll do what you usually do when making a decision about medical treatment or medication for your child. For many of us, this means talking to our child's doctor or pharmacist, and then making an informed decision about what to do. All medications, including vaccines, undergo rigorous testing to identify possible side effects, because all medications have side effects. In most cases, we tolerate the low risk of side effects and the risk of rare adverse events because we need the benefit we're going to get from taking the medicine. This is especially true for life-saving medicines such as those we take for cancer, asthma, and heart disease. Vaccines are in this group of medicines as well, with the added benefit that they offer protections to not only the person getting vaccinated, but also thousands of other people who may not be able to get vaccinated or for whom the vaccines don't work as well. We're going to be working to ensure that everyone has good access to high quality information about vaccine safety and accessing vaccination for children, as we continue to expand vaccination opportunities countywide. We'll advance 2 more slides, I think now. One more, this one. Children getting vaccinated, do need to bring with them a consent form signed by an adult that's responsible for the child. And that consent form can be signed by the adult at the vaccination site. At some vaccination sites, including those run by public health, children under 16 must be accompanied by a responsible adult. You don't need to show identification in order to get a vaccine, nor do you need to be a United States citizen to get vaccinated. As you can see from the map on the right side of this slide, a network of nearly 900 providers countywide will be offering vaccines to children between the ages of 5 and 11. And many of these providers already have received vaccine and began vaccinating. This map shows providers offering COVID vaccines to children superimposed over a map that shows the density of children in each age group, in this age group across the county. The highest numbers of 5 to 11-year-olds live in the areas that are shaded darker green, while lower numbers live in the lighter colored areas. Approved providers, including federally qualified health centers, county sites, hospitals, pharmacies, pediatrician and family medicine practices, and clinics are shown in these multicolored markers. I want to note that almost all federally qualified health centers are offering pediatric vaccines, and they're listed here under multiple categories, including as a fixed site clinic, a mobile team site, or what we call a vaccine for children sites. For this week, we encourage parents to call ahead of time to providers that are listed on the map to make sure that they've received their doses and they're able to offer vaccines to children 5 to 11. As a reminder, the vaccines for younger children are a different vaccine. They're in a different vial and a different package, the providers cannot use the adult and the teen vaccines for younger children. All 6 of the DPH community sites have already begun vaccinating children, and parents can bring their children into these sites without appointments. As you can see, there are several areas in the San Fernando Valley, Antelope Valley, and South Central LA where the number of providers is not in proportion to the number of children who are eligible for vaccinations. In these areas, our mobile vaccination teams are going to work hard to supplement vaccinations offered by existing providers so that everywhere children have easy access to the most powerful protection from COVID. School vaccination sites form another pillar for our vaccination plan. Many parents have requested that we offer vaccines to children and teens at schools because these are familiar and trusted places. School vaccination clinics have already been an important part of our community vaccination strategy. Over the course of the month of November, there'll be 480 school-based events where children will be offered vaccines. And this will obviously focus on schools in our highest need areas. Our hope is that with many opportunities for children to receive their COVID vaccine, parents will find a site where they and their children feel comfortable getting vaccinated so that they can be fully protected before the winter holidays. Next slide. Just as a reminder, today our health officer order requiring proof of full vaccination and photo ID for indoor entry into bars, breweries, wineries, distilleries, nightclubs, and lounges for all patrons and employees goes into effect. You'll need to be fully vaccinated to be indoors at any of these establishments beginning today. Preliminary compliance findings for the weekend of October 23rd and 24th found that 90% of bars and 100% of nightclubs and lounges visited were in full compliance with the health officer order, which at that time required vaccine verification of at least 1 dose. Next week, on November 8th, the City of Los Angeles vaccine verification program called Safe Pass LA goes into effect, and this will require proof of full vaccination for entry into the indoor portions of restaurants, coffee shops, breweries, wineries, bars, gyms, spas, nail salons, barbershops, movie theaters, shopping malls, and entertainment and recreation venues. This includes the indoor portions of city facilities such as City Hall, senior centers, recreation centers, and service centers. We'll be working closely with the City of LA to educate businesses and residents on the requirements of Safe Pass LA throughout this upcoming month. and will unveil a virtual training and certificate program for LA City businesses sometime later next week. The Biden administration just announced January 4th deadline for the full vaccination of workers, including non-clinical employees and contractors at healthcare facilities funded by the Centers for Medicare and Medicaid Services. These facilities may grant certain medical or religious exemptions to employees, but employees will not be able to choose a testing option as an alternative to being vaccinated. Yesterday, the administration set the same deadline for full vaccination of workers at businesses with more than 100 employees. Businesses can offer their employees an option involving routine testing and mandatory masking. These targeted mandates are all aimed at ensuring that in health facilities, workspaces, and public spaces where the risk of transmission is higher, everyone can be fully vaccinated. With powerful and safe vaccines, this is the surest manner of quickly reducing spread and allowing for continued economic recovery. We all follow rules every day that affect our personal choices. We're required to use seatbelts, wear helmets when we're on a motorcycle or a bicycle, not smoke around others, follow traffic rules, abide by firearm registration and safety rules. At workplaces, some of us are subject to routine drug testing, and we need to be vaccinated against certain communicable diseases as a condition of employment or to attend schools and institutes of higher education. Regardless of who's making the rules, we all need to follow them or face consequences when we choose not to follow them. For none of us is it a free-for-all. Rather, these rules are part of the human contract we each need to embrace. Next slide. Another important strategy for preventing a significant surge this winter is to plan for safe holiday gatherings. For this Thanksgiving, which is in 3 short weeks, we know that everybody is able to get together with those they love, but there are some ways to do this with more safety. It's best, of course, if everyone eligible is getting vaccinated or is vaccinated. If this isn't possible, we do recommend staying local until everyone who can get vaccinated is fully vaccinated. And if possible, to gather outdoors. Keep gatherings small, and if unvaccinated or high-risk people are present, including older adults and people with weakened immune systems, wear face masks indoors when not eating or drinking, and outdoors if it's very crowded. In these situations, it's also a good idea to keep a distance between non-household members while eating, especially if you're eating indoors. And if possible, have guests verify a negative test before gathering. We do all want to be together for the holidays, and let's be mindful to do so safely. And in order for that to happen, we do need to consider some small but important safety modifications, as I noted above. None of us want to end up sick, hospitalized, or needing to quarantine or isolate over the December holidays because of exposures we had during Thanksgiving. Thanks, and now I'm happy to answer your questions.
Thank you, Dr. Ferrer. As a reminder, if you have a question, you may use the hand icon or you may chat me, the host, to get your question in queue. Our first question is going to come from Ron Lin from LA Times.
Hi, Dr. Ferrer. Thanks so much for taking our questions. Really appreciate it. Our questions today on demand for boosters, fifth surge, and low vaccination rates among young Black and Latino males. First, on booster shots, you mentioned on Tuesday that only 9% of nursing homes in the county had completed booster shot clinics. And you said today that 27% of seniors in LA County had received a booster shot. San Francisco is also reporting something similar. 20% of seniors getting the booster shot. The state has also told us that demand for boosters as of early October were far lower than their estimates. Are you alarmed that uptake for boosters has been relatively low? And if this doesn't change, do you think there's increased risk of hospitalizations among the elderly and immune compromised? Second, we've noticed that hospitalizations are no longer declining, not only in LA, but in Orange and Ventura counties, and hospitalizations are up by like 20% in San Bernardino County since mid-October. Do you think we're heading into a fifth wave, or is it too soon to say? And then finally, we saw that the county has made progress, but is still lagging with getting Black and Latino males vaccinated. What do you think it will take to get more of them vaccinated? Thank you.
Yeah, thanks so much. Let me start with the last question, just because I didn't write it down yet, about, what's it going to take for us to, sort of narrow these persistent gaps. I think it's going to take a lot of consistency on our part to build more trust in communities that have, in the past had some good reasons for not being so trustful, for getting misinformation, for not having resources available that really promoted their health and well-being. So, I think what we're doing is the right track, but it's still going to take some time. We have to make sure that we never forget, most importantly, access has to be there, be easy, straightforward. We also have to be able to answer people's questions and answer them as long as it takes for folks to develop some confidence in these vaccines. I want to note that we also need to be present and make sure people understand we're in this for the long haul as well. So our sites, for example, that we're running, lots of people just assumed we'd come in, do a couple of weeks of vaccinations and then leave. But we're in the hardest hit communities with, in some of our communities, the lowest vaccination rates. So we're not leaving. We're staying there. We have community health workers and promotoras from the communities that are doing outreach every single day, knocking on people's doors, going to places where people are gathering, not to, sort of be obnoxious about the need for people to get vaccinated, but more importantly, to just be able to answer people's questions and provide them with good information, particularly because there's a lot of misinformation that still, is circulating. I also think, we've contracted with lots and lots of organizations that are trusted in these communities, and we rely heavily on local leaders and other community organizations to also, answer people's questions and help people feel comfortable that the information that we're sharing is accurate. It's a sad state of affairs where, the government agencies that are really responsible for helping us all be safe cannot be trusted, and we all have to own part of the reason why that feeling is so prevalent. And the best way to do that is to go about fixing it and being present and making sure that people do have the resources they need to be healthy. So that's the work in front of us, and we're going to continue to do it as long as it takes. We're going to be there for months if that's what it takes to help people come on in and get those doses. There's no timeline here that says, we do this for a few more weeks and then we're done. We're done when everyone who needs to get vaccinated is getting vaccinated. And then in terms of your other questions, the demand in boosters, I'm not really alarmed. I think there was some confusion, particularly because first we had approval for Pfizer and then it was Moderna and Johnson & Johnson. And there are slightly different rules for who can get the vaccines and how long do you need to be out from your last dose of your initial series. So this is an area where I think we can do a better job on getting that information out now, particularly since everybody is eligible for a booster, regardless of whether they got Pfizer, Moderna, or Johnson & Johnson, depending on the timing of their last dose and their criteria, their eligibility criteria for risk, related to risk. In terms of the nursing homes, one reason why we're, might look like we're a little behind there is because the vast majority of residents in our nursing homes were vaccinated with Moderna. And as you remember, until the middle of October, we had no mix and match strategy that was allowed for boosters, and Moderna and Johnson & Johnson were not yet permitted for boosters as well. So I think we're making good progress. We've set a 4-week deadline. So by November 20th, all residents who want their boosters in our skilled nursing facilities will have had that opportunity to get vaccinated. We feel pretty confident working with all of our partners, long-term care, pharmacies, and obviously all of the nursing homes that we're going to get that done. And also, we have a policy now with our mobile teams that they need to be able to offer boosters as well, and make sure that those first, second, and third doses are being taken right out into the communities. We've been concentrating on senior housing developments as well as senior centers over the past 2 weeks with some of our mobile teams, just again, because of what you said. You know, we want to make sure that those at highest risk for serious illness and now eligible for a booster are absolutely getting their boosters before we head into the winter and the holiday season. So we'll continue to do a lot of work. You know, in some ways, we're really blessed in LA County because we have such a vast network. So I think it's just a matter of making sure people understand when it is that they need to come in and get their booster. And we'll continue to work with our partners on getting that information out. I want to note that, you know, we offer free transportation for people to get their boosters. All the homebound residents that we already vaccinated with their first series, we're calling them, or our partners are calling them to arrange for us to come back out to their homes and give them their boosters as well. I do agree with you that it's troubling to continue to see, you know, a slight uptick in cases, and now obviously no decline here in our hospitalizations. I think it's too soon to say that we're in a fifth wave or a surge yet. I think, again, we've got to do what we know works, get more people vaccinated, wear our masks when we're indoors, because again, that's a powerful way to prevent some transmission from happening. Take a lot of care at our gatherings and make some wise choices, particularly if we're older people or we have some underlying health conditions. You know, my hope is that while I'm prepared for us to see this increase, and certainly all of our providers are prepared, we're hoping at best it's a small bump up and nothing like what we saw last winter, but that takes all of us to get there. And, you know, the small numbers of people I think that are detracting from the messaging about the importance of really being safe this winter need to get less attention, so that those that are doing the right thing are actually getting more attention, because there are way more people that are doing the right thing and that care deeply about what happens across LA County and about the obligations to take care of each other. So, you know, let's focus on, you know, all that is happening that helps us avoid that winter surge in the next few weeks. But we can take the next question. Thanks, Ron.
Thank you. Our next question comes from Ryan Carter from Los Angeles Daily News.
Good afternoon, Dr. Ferrer. Thank you again for this time. Given that uptake that you've been talking about, just curious if you had any concerns about you know, the running of the marathon this weekend. Any words of concern or guidance as we go into it? You know, and maybe just sort of in connection with that, any lessons learned from last year's event, which I know was like literally right on the cusp of the shutdowns. And I guess, was there any evidence actually from that event that there was some spread? So that's what I've got for you today. Thank you.
Yeah, thanks, Ryan. And I want to, you know, again, congratulate everybody who will be running on Sunday. We're excited for you. I also want to thank the marathon organizers who have been working with us from day one to plan for this event to be as safe as possible. They've made a lot of modifications so that the runners will be safe. And of course, you know, in terms of spectators, it's up to all of us, you know, to keep our distance. If we're in crowded places, as always, you know, put your mask on. If, you know, you happen to be watching from a place where there's 100 other people all crowded together trying to watch. It's a long route, so people have plenty of opportunity to spread out. And again, the beginning of the race and the end of the race, the organizers have been great about adding in extra safety measures. So I feel comfortable. You know, it's an outdoor event. The biggest issue with outdoor events is when there's just a lot of crowding for longer periods of time. So hopefully, you know, spectators avoid being in those situations. And I know that the marathon organizers have really gone to great lengths to limit the amount of crowding that's going to happen among the runners. You know, the good thing is when they're running, they're often, you know, not very close to everybody else for, again, extended periods of time. And that too will make it safer for the athletes. Most of the athletes are in fact vaccinated, and that's the other good news as well. So, but thanks for that, Ryan. Just as a reminder, it's often hard, to really pinpoint exactly where somebody got infected because of that long incubation period. Our best information comes when people actually themselves know who infected them. I was running the marathon with a buddy. We shared a hotel room. My buddy got infected, then I got infected. Probably not likely due to the exposure from running the race, more likely to be due from the exposure at the hotel. So that's why we have, case and contact tracing so that we can actually try to sort out the exposures. But with a 14-day window for transmission, it's super hard to often pinpoint exactly where somebody ended up getting their exposure.
If there are any additional questions, please use the hand icon now.
Yeah, I just, before we close, then, I just
Actually,
wanna-
sorry, Dr. Frere, I think, Ron, do you have a follow-up?
Okay.
Yeah,
Andy?
thanks so much. Are there any lessons we should take from Mayor Garcetti's breakthrough infection? Does it illustrate the risks of waning immunity or the risks of infections in crowded situations? Thanks so much.
Yeah, I think it's a great question. Obviously, there's waning immunity. We've seen that it's most important for people who are older and at more serious risk because of underlying health conditions to get those boosters in a timely way. Because of that, the immunity where it's really showing up as a problem is in, sort of an increased ability for people to end up more seriously ill. I'm sending my prayers to the mayor. He is reporting that he has mild symptoms, and I'm hoping it just continues to stay that way and he has a quick recovery. But I know, people are so tired of masking and, our requests like to be super careful if you're indoors in crowded situations or outdoors in super crowded situations. But it is because the vaccines are not 100% effective. Even, right after you're fully protected, they're not 100% effective. And, as long as there's a lot of circulation of the virus that, as you can see from our data, fueled, unfortunately, by those that are not yet vaccinated, all of us who are vaccinated are going to be at increased risk. And that's why we ask you to take these additional precautions. It's not because we don't want people to get vaccinated, and it's not because we don't think these vaccines are really, really powerful. They're our best tool, hands down, for avoiding disastrous consequences from COVID, but they're not perfect. And as we can see, because I don't think it's just, we all now have heard that the mayor unfortunately had a post-vaccination infection, but many of us know friends or family members that also have experienced post-vaccination infections at this point. I mean, it's over 60,000 people just here in LA County. That's a large number of people. It's still only, slightly more than 1% of everyone who's gotten vaccinated, but it's a real risk. And these extra protections that we're asking everyone to take are really going to be necessary until we get this rate of transmission way down so that there's not this much risk for everybody when they're gathering in these closer crowded situations. So, but thanks for that. Unfortunately, I do need to go, so we can't take any more questions today, but if we didn't get to a question, please just contact us and we're happy to go ahead and answer that later today. I also want to thank all of you, as always, every time we have these new opportunities or we have new safety measures going into effect, we rely so heavily on you and your ability to communicate with folks. I particularly want to thank everybody who covered all of the opportunities yesterday for spreading the word that, here in this county, if you have a child 5 to 11, you can go ahead and get them vaccinated pretty easily. Again, you've been great partners on all of this work, and we thank you from the bottom of our heart for everything you're doing. So thanks a lot, everyone, and we'll see you next week.
Thank you so much, Dr. Frere. As a reminder to everyone, next week's briefing will be on Friday, the 12th. Thank you for joining us today, and Spanish remarks will be in just a few minutes. Hi, Monica, can you hear me?
Yes, I can hear you.
Okay, let me get your slides up here. Oh, I'm sorry. There we go. We'll get you started on the first slide. Great. Are you able to view the slides?
Yes, I do.
Wonderful. Good afternoon, everyone. Thank you so much for joining us for the Spanish portion of today's briefing. Today is November 4th. As a reminder, this briefing will take place on Friday, the 12th next week due to the Veterans Day holiday on Thursday, the 11th. Monica, you may begin when you're ready.
Thank you so much, Kim. Gracias por acompañarnos en la sesión informativa de esta tarde. Hoy les presentaremos nuestras métricas por estado de vacunación y grupos raciales y étnicos. Brindaremos una actualización sobre las variantes y compartiremos información sobre casos y brotes de deportes escolares y juveniles. También discutiremos nuestro progreso en la administración equitativa de las vacunas y refuerzos y brindaremos información sobre la administración de vacunas a los niños y cerraremos con algunos recordatorios de lo que todos podemos hacer para celebrar el Día de Acción de Gracias de manera segura. Esta primera diapositiva nos entristece informar de 12 muertes más. Al menos 14 de las personas que murieron tenían problemas de salud subyacentes. Esto eleva el número total de muertes a 26.695 en el condado de Los Ángeles. Nuestros corazones están con todos quienes han perdido a sus seres queridos, amigos o compañeros de trabajo a causa de este virus y compartimos con ustedes nuestra esperanza para su alivio y consuelo. Hoy estamos reportando 1.829 casos nuevos, lo que eleva el número total de casos en el condado de Los Ángeles a 1.498.393. El mayor número de casos hoy refleja retrasos en la notificación de 396 pruebas positivas de uno de nuestros laboratorios de pruebas más grandes entre el 18 y el 29 de octubre. Es probable que veamos números más altos en los próximos días a medida que se incluyan pruebas pendientes adicionales en nuestros recuentos de casos. A la fecha se han realizado pruebas a más de 9 millones de personas y sus resultados se han informado al condado de Los Ángeles. Nuestra tasa diaria de casos positivos con base en la prueba es de 1,55%, un pequeño aumento con respecto a la tasa del mismo día de la semana pasada del 1,19%. Nuestra tasa de casos promedio diaria con un retraso de 3 días es ahora de 9,8 casos por cada 100,000 personas, un aumento de la tasa de casos con un retraso de 3 días de la semana pasada de 6,1 casos por cada 100,000. Los CDC ahora estiman que nuestra tasa de casos semanales será 84 casos nuevos por cada 100,000 residentes, lo que refleja que el contagio sustancial continúa en todo el condado. Hay 662 personas hospitalizadas actualmente con COVID, un aumento de 13 personas con respecto a la semana pasada. Actualmente hay 122 investigaciones abiertas en entornos residenciales congregados y entornos no residenciales con al menos un caso confirmado de COVID-19. Next slide, please. Este gráfico muestra las tendencias en casos, hospitalizaciones y muertes en nuestro condado desde el comienzo de la pandemia al 27 de octubre de este año. Seguimos viendo datos estables en todas nuestras métricas con signos de un posible repunte en el contagio en los últimos días. Debemos tener en cuenta que los 1.200 casos atrasados adicionales de un laboratorio que ocurrieron durante la última semana y mediados de octubre afectarán nuestro número de casos y las tasas de la última semana de octubre, que se espera que aumenten una vez que asignemos todos los casos atrasados a la fecha apropiada del episodio. No vimos ningún cambio en nuestro promedio diario de hospitalizaciones, que se mantuvo estable en 630. Las muertes disminuyeron solo ligeramente a entre 7 y 8 muertes por día, y la evaluación de los CDC de nuestra tasa de casos semanales, que refleja cifras más recientes, sugiere que cada semana estamos viendo 84 nuevos casos por día por 100.000 residentes, lo que refleja que el contagio sustancial continúa en todo el condado. Ha llegado un clima más frío y con él condiciones que favorecen el contagio del COVID, dado que nos reunimos adentro para abrigarnos y para celebrar y festejar. Si bien las vacunas siguen siendo nuestra herramienta más poderosa para reducir la propagación del virus, el uso de mascarilla en interiores y en espacios exteriores cuando estamos con mucha gente sigue siendo una capa importante de protección para todos nosotros. Pedimos que todos continúen haciendo su parte para cumplir con los requisitos de uso de mascarilla, que probablemente permanecerán vigentes durante el resto de este año calendario, mientras trabajamos arduamente para reducir las tasas de contagio comunitario al nivel moderado, menos de 50 casos semanales por 100.000 residentes. Para alcanzar esta meta, el número de casos nuevos diarios debería reducirse a unos 700 casos por día. Next slide, please. Si hay dudas sobre lo que probablemente está impulsando nuestros ciclos de aumento repentinos, puede ver la respuesta más probable en esta diapositiva, con las tasas de casos ajustadas por edad en verde, las tasas de hospitalización en naranja, las líneas continuas que representan los resultados en las personas vacunadas y las líneas punteadas que representan los resultados entre las personas no vacunadas. Como puede ver, tanto las tasas de casos como las de hospitalización se mantienen estables entre las personas vacunadas, pero ahora están aumentando entre las que no han sido vacunadas. Las diferencias entre estos grupos siguen siendo marcadas. Las personas no vacunadas tienen 7 veces más probabilidades de infectarse y 27 veces más posibilidades de ser hospitalizadas que las personas vacunadas. Cuando el contagio comunitario es mayor, podemos esperar que más personas vacunadas también desarrollen infecciones, aunque siempre a una tasa mucho menor que las personas no vacunadas. También podemos esperar que un pequeño subconjunto de estas personas vacunadas, probablemente las más ancianas y médicamente frágiles entre ellas, deban ser hospitalizadas. Esto se debe a que, lamentablemente, las personas no vacunadas crean un riesgo para todos. La vacunación, que puede inmunizarnos por completo contra las consecuencias de las oportunidades que corren las personas no vacunadas. Su riesgo eventualmente se extiende a los residentes vacunados y hace que todos necesitamos tomar protecciones adicionales, como el uso de mascarilla, para reducir las posibilidades de contraer y contagiar el virus. Es por eso por lo que sigue siendo importante para nosotros acercarnos a las personas que aún no se han vacunado y ofrecerles cualquier vía de vacunación que pueda funcionar para ellos. Muy a menudo eso significa comunicarnos con las personas en lugar de discutir con las personas. Todos los que hemos experimentado el alivio de estar vacunados podemos ser parte de la invitación que como sociedad ofrecemos a quienes aún no se vacunan al compartir información sobre la vacunación o simplemente al compartir cuánto más seguros nos sentimos después de recibir nuestras vacunas. Cerrar esta brecha puede que tome más esfuerzo de nuestra parte. Next slide, please. Las brechas en los resultados entre los grupos raciales y étnicos en todo el condado han persistido durante la pandemia y son una consecuencia de las desigualdades históricas en el acceso a los recursos que promueven la buena salud. En esta diapositiva puede ver las tasas acumuladas de casos de 30 días en verde y las tasas de hospitalización en naranja entre los residentes latinos, blancos, afroamericanos y asiáticos del condado de Los Ángeles. La tasa de los residentes vacunados se muestran en barras sólidas, mientras que las tasas de los residentes no vacunados se muestran en barras cruzadas. Entre el 24 de septiembre y el 23 de octubre, las tasas de casos fueron consistentemente de 2 a 3 más altas para los residentes no vacunados en cada grupo en comparación con los vacunados. Las tasas de casos más altas se dieron entre los residentes latinos no vacunados, seguidos por los residentes blancos, afroamericanos y asiáticos. Mientras tanto, las tasas de hospitalización fueron entre 5 y 9 veces más altas entre los residentes no vacunados y fueron más altas en los residentes latinos y afroamericanos, seguidos de los residentes blancos y asiáticos. Next slide, please. Esta diapositiva muestra la tasa de mortalidad ajustada por edad en el condado de Los Ángeles, con líneas de puntos que representan nuevamente los resultados en personas no vacunadas y líneas continuas que representan los resultados en personas vacunadas. La tasa de mortalidad entre las personas vacunadas sigue siendo casi plana, mientras que las muertes entre las personas no vacunadas siguen siendo elevadas y, por desgracia, ahora están aumentando. Para el 16 de octubre, el riesgo de muerte era 41 veces mayor entre las personas no vacunadas que entre las que habían sido vacunadas. Next slide, please. Al observar las tasas de mortalidad entre los grupos raciales y étnicos, podemos ver que el riesgo de muerte es mucho más alto en todos los grupos entre las personas no vacunadas, que de nuevo están representadas en las barras con rayas. Los residentes latinos y blancos tenían las tasas de mortalidad más altas, seguidos por los residentes afroamericanos y asiáticos. Next slide, please. Continuamos monitoreando los resultados entre las personas completamente vacunadas para comprender mejor el nivel de protección que brindan las vacunas y para rastrear las infecciones posteriores a la vacunación. Aquí el número de casos, hospitalizaciones y muertes entre personas completamente vacunadas se visualiza a escala. El gran recuadro verde representa a los casi 5,9 millones de residentes que ahora están completamente vacunados. El pequeño recuadro violeta en la esquina inferior izquierda, este recuadro verde representa a las casi 69,000 personas totalmente vacunadas que dieron positivo por COVID al 2 de noviembre del 2021. En total, alrededor del 1,2% de las personas totalmente vacunadas en el condado de Los Ángeles dieron positivo. De los que dieron positivo, alrededor de 2,300 personas fueron hospitalizadas, lo que se traduce en que un 0,04% de todas las personas completamente vacunadas son hospitalizadas. Ha habido 379 muertes en este grupo, lo que quiere decir que el 0,006% de las personas totalmente vacunadas fallecieron. Este número incluye hoy 15 muertes ocurridas entre marzo y septiembre de este año en individuos vacunados que se presume se volvieron a infectar. En el pasado, estos casos no se incluyeron porque sus muertes no estaban asociadas con una infección reciente por COVID. Con la definición aceptada que se consideran casos nuevos, los de personas con una prueba positiva después de 90 días, estas muertes se han reclasificado como asociadas con COVID-19. Next slide, please. Recibimos información de forma rutinaria sobre las variantes de COVID-19 de varios laboratorios que llevan a cabo la secuencia en los residentes del condado de Los Ángeles y monitoreamos las tendencias en las variantes que circulan localmente para ayudar a comprender nuestros patrones de enfermedades locales y permitirnos conocer temprano si aumenta la frecuencia con que aparece una variante de preocupación. Las nuevas variantes, especialmente si se demuestra que causan una gravedad diferente de la enfermedad o que se propagan de manera diferente en las comunidades, pueden impulsarnos a ajustar las recomendaciones que hacemos para ayudar a los residentes a mantenerse seguros a sí mismos y a sus seres queridos. Esta diapositiva muestra el cambio en la frecuencia de las variantes identificadas entre los residentes del condado de Los Ángeles como porcentaje de todas las secuencias informadas a salud pública entre enero de este año y el 23 de octubre. La variante Delta, aquí representada en rojo, surgió a fines de mayo y rápidamente dominó la escena. Esta variante sigue siendo la que predomina entre nuestros residentes y ahora representa el 100% de los casos. Continuaremos monitoreando los informes que recibimos para ver si vigilamos otras variantes. Next slide, please. Todos queremos que los niños puedan seguir asistiendo a clases presenciales y participando en actividades escolares. Monitoreamos de manera rutinaria los casos entre el personal y los estudiantes en las escuelas para identificar los desafíos que surjan. En este gráfico, las líneas de tonos rosados representan casos, mientras que las líneas de tonos verdes representan contactos cercanos. Los tonos más oscuros representan los datos de los estudiantes, mientras que los tonos más claros representan los datos del personal. Como recordatorio, debido a que la cantidad de contactos cercanos de los estudiantes es mucho más alta que las otras métricas en esta diapositiva, ella se traza en una escala diferente que se indica a la derecha de la diapositiva. La semana pasada vimos 670 casos de estudiantes y más de 3.100 contactos cercanos de estudiantes. Entre el personal vimos alrededor de 110 casos y 250 contactos cercanos. Estos números de casos representan una disminución del 26% en los casos de estudiantes y una disminución del 29% en los casos del personal con respecto a la semana anterior. El aumento en los contactos cercanos del personal se debe en parte a varios brotes cuyo lugar de origen fue la sala de descanso del personal. Esto equivale a un 0,2% de pruebas positivas entre los estudiantes y el personal examinado, con un 0,2% identificado como contactos cercanos. Estos bajos números son el resultado del trabajo que nuestras comunidades escolares han hecho para reforzar las protecciones que mantienen seguros a los estudiantes y al personal, y estamos agradecidos por su colaboración en este esfuerzo. Esperamos que estos números disminuyan aún más a medida que más y más niños se vacunen para protegerse a sí mismos, a sus amigos y familiares de la infección por COVID. Next slide, please. Aunque la mayoría de los casos de transición a grado 12 no están asociados con brotes, 3 o más casos relacionados con el contagio en las escuelas o programas escolares cumplen con la definición de brote. Hubo 9 brotes en la semana que terminó el 31 de octubre, 7 en escuelas primarias y 2 en escuelas intermedias. Con más de 3.000 escuelas de transición o grado 12 en nuestro condado, este es un número notablemente bajo de brotes. Esperamos seguir viendo brotes, pero a medida que más niños son aprobados para recibir la vacuna, anticipamos que estos números disminuirán. Next slide, please. Con la impresionante protección que ofrecen las vacunas, estamos agradecidos con los aliados por administrar casi 13,4 millones de dosis de vacunas en las comunidades de todo el condado. Al 31 de octubre, el 94% de los residentes del condado de Los Ángeles de 65 años o más habían recibido al menos una dosis de la vacuna, al igual que el 80% de los residentes de 12 años o más. El 72% de los residentes mayores de 12 años están completamente vacunados. El 73% de los adolescentes del condado de Los Ángeles entre las edades de 12 a 17 recibieron al menos una dosis y el 64% están completamente vacunados. De todos nuestros casi 10,3 millones de residentes del condado de Los Ángeles, incluidos aquellos que aún no están en los grupos aprobados para recibir la vacuna, el 69% ha recibido al menos una dosis y el 62% está completamente vacunado. Hasta ahora, se han administrado casi 610,000 dosis adicionales o de refuerzo en el condado de Los Ángeles. Las dosis de refuerzo siguen estando disponibles para muchas personas que recibieron sus segundas dosis de la vacuna Pfizer o Moderna hace al menos 6 meses y para aquellas que recibieron una vacuna de Johnson & Johnson hace al menos 2 meses. Next slide, please. Desafortunadamente, seguimos viendo números semanales relativamente bajos de primeras dosis de vacuna administradas en la red de nuestro condado. Como puede ver en este cuadro, entre el 25 y el 31 de octubre administramos alrededor de 38,000 dosis en toda la red del condado, un número similar al de la semana anterior. Si bien las cifras de la semana pasada podrían aumentar en unos pocos miles una vez que se completen todos los informes, y nos alegra ver que estas cifras no disminuyen, esto aún no representa el aumento en las primeras dosis que necesitamos, ya que nos preocupa un posible aumento repentino de casos durante el invierno. Como recordatorio, las personas vacunadas y sin vacunar no estamos en lados diferentes aquí. Todos estamos del lado humano. Y como comunidad, todos queremos evitar otro terrible pico invernal. Ayudémonos los unos a los otros a hacer eso. Next slide, please. Hemos estado analizando cuáles de nuestros residentes han recibido dosis de refuerzo o adicionales de la vacuna para asegurarnos de que los más vulnerables estén al frente de la fila. En esta diapositiva puede ver el número de residentes completamente vacunados en cada grupo de edad, así como el número y el porcentaje de los que están completamente vacunados y que han recibido una dosis de refuerzo o adicional. En la columna de la derecha nos complace ver que más de una cuarta parte de nuestros adultos mayores de 65 años o más han recibido una dosis de refuerzo o adicional, con el 10% de los adultos de 50 a 64 años y el 6% de los adultos de 30 a 49 años que también recibieron estas dosis. Por favor, tengan en cuenta que muchos residentes representados aquí como parte de la población total aún no han sido aprobados para recibir los refuerzos, ya que se han vacunado recientemente o tienen un riesgo relativamente bajo. Next slide, please. Es menos tranquilizador ver los datos de la administración de los refuerzos por grupos raciales y étnicos. Aquí vemos que los residentes blancos son quienes más han aceptado la dosis de refuerzo o adicional, pues el 16% de ellos han recibido estas dosis, seguidos por los residentes asiáticos con un 13% y por los residentes afroamericanos con un 9%, los indígenas americanos y nativos de Alaska con un 8% y los latinos con un 6%. Sospechamos que estas diferencias no se explican tanto por las diferencias en la aprobación de los grupos como por las diferencias en la comprensión de lo que hacen los refuerzos, a quienes protegen y a dónde pueden acudir las personas para obtener una dosis de refuerzo. Next slide, please. Nuestros sitios de vacunación tienen como objetivo abordar algunas de estas brechas en la administración de los refuerzos y ubicarse en las áreas donde la necesidad y la vulnerabilidad son mayores. En este mapa de códigos postales del índice de lugares saludables están marcados en verde pálido y puede ver los 834 sitios fijos del Departamento de Salud Pública y de nuestros aliados en todo el condado donde los residentes pueden ir a recibir la dosis de refuerzo de las 3 vacunas, así como su serie de vacunas primarias. El 44% de nuestros sitios de vacunación fijos se encuentran en comunidades de alta necesidad. Next slide, please. Cientos de nuestros equipos móviles de vacunación también persisten en sus esfuerzos por llenar los vacíos en los vecindarios donde viven y trabajan personas no vacunadas y por administrar la primera y segunda dosis de la vacuna, así como sus dosis de refuerzo o adicionales. Como puede ver en este mapa, hay programadas esta semana 427 visitas de unidades móviles enfocadas en llevar las vacunas a los lugares donde la comunidad se reúne, especialmente en las áreas de mayor necesidad de nuestro condado. Casi todos estos sitios ofrecen dosis de refuerzo. En nuestro sitio de internet cualquiera puede pedir un equipo móvil de vacunación para que vaya al lugar de la comunidad o a un lugar de trabajo. Vale la pena recordar que todo lo que necesita llevar a su cita si desea una dosis de refuerzo es el comprobante de su serie original de vacunas, es decir, su tarjeta de vacunación blanca, una foto de su tarjeta de vacunación, un registro médico que documente que ha recibido estas vacunas o su registro de vacunas digital. Next slide, please. Con la vacunación de niños de 5 a 11 años, ahora en todo el país, queremos brindarles el contexto para este esfuerzo de vacunación, mostrándoles algunos datos presentados el martes en la reunión del Comité Asesor de Prácticas de Inmunización de los CDC. Esta diapositiva muestra el número promedio de inmunizaciones de los CDC. Esta diapositiva muestra el número promedio de muertes pediátricas anuales en los Estados Unidos causadas por enfermedades que se pueden prevenir con vacunas en los años previos a la aplicación de las vacunas creadas para prevenir estas enfermedades. Como puede ver, la cantidad de muertes de niños debido a estas enfermedades fue como máximo 1/3 de la cantidad de decesos causados por COVID-19. En las épocas en que se comenzaron a administrar estas vacunas, esas muertes fueron suficientes para provocar que como sociedad estuviéramos de acuerdo en que necesitábamos vacunas para prevenir esas enfermedades. Y esta diapositiva no describe la cantidad adicional de las hospitalizaciones y las enfermedades crónicas debido a esas enfermedades, y mucho menos sus horribles efectos entre los niños más allá de las fronteras de Estados Unidos. Lo que queda claro es que cuando la incidencia de la enfermedad pediátrica es peligrosa y la vacuna es segura y eficaz, históricamente hemos acordado que la vacuna debe formar parte de la rutina de salud preventiva de los niños. Next slide, please. Por esta razón, muchos padres sintieron un gran alivio cuando a principios de esta semana los CDC aprobaron el uso de las vacunas en niños de 5 a 11 años. Hay muchas y muy buenas razones para vacunar a los niños de este grupo de edad. Además del hecho de que la infección por COVID puede provocar hospitalización, muerte, síndromes inflamatorios y síntomas a largo plazo en poblaciones pediátricas, los niños pueden contagiar el virus al menos con la misma eficacia que los adultos. En un estudio de los CDC en Utah, 12 de 110 niños que estuvieron expuestos a COVID en 2 guarderías, el 11% de los expuestos se infectaron. Esos niños contagiaron la infección a 12 contactos domésticos adultos, uno de quienes fue hospitalizado. Imagínense que en lugar de 12 niños, estamos hablando de los 900,000 de nuestros niños de 5 a 11 años en este condado. Con la misma tasa de infección veríamos 98,000 niños infectados y la misma cantidad de adultos contagiados. Y veríamos 8,000 adultos hospitalizados. Por supuesto, extrapolar de esta manera no siempre representa la realidad, porque hay otros factores que afectan la propagación, pero el papel de los niños en una transmisión de infecciones es muy real. Y las olas de infección que pueden resultar si los niños no están protegidos también desafortunadamente lo son. Mientras tanto, se ha demostrado que la vacunación tiene una efectividad del 91% en la prevención de infecciones en este grupo de edad con solo efectos secundarios leves. Vacunar a los niños es un paso importante para protegerlos a ellos, a sus hogares y a las comunidades en las que viven. Sé que muchos padres y quienes están al cuidado de los niños todavía tienen muchas preguntas sobre la vacunación de sus hijos y esperamos que hagan lo que suelen hacer cuando toman una decisión sobre un tratamiento médico o un medicamento para su hijo, lo que para muchos significa hablar con el médico de su hijo o con el farmacéutico y luego tomar una decisión informada sobre qué hacer. Todos los medicamentos, incluidas las vacunas, se someten a pruebas rigurosas para identificar posibles efectos secundarios, porque todos los medicamentos tienen efectos secundarios. En la mayoría de los casos, toleramos el riesgo de los efectos secundarios y el riesgo de los eventos adversos raros, porque necesitamos el beneficio que obtenemos al tomar el medicamento. Esto es especialmente cierto para los medicamentos que salvan vidas, como los que tomamos para el cáncer, el asma y las enfermedades cardíacas. Las vacunas también se encuentran en este grupo de medicamentos, con el beneficio adicional de que ofrecen protección, no solo a la persona que se va a vacunar, sino también a miles de otras personas que quizá no puedan vacunarse o para quienes las vacunas no funcionan bien. Trabajaremos para asegurarnos de que todos tengan un buen acceso a la información de alta calidad sobre la seguridad de las vacunas y el acceso a la vacunación para los niños a medida que continuamos ampliando las oportunidades de vacunación en todo el condado. Next slide, please. Los niños que se vacunen deben traer consigo un formulario de consentimiento, firmado por un adulto responsable que esté a cargo del niño. Y este formulario de consentimiento puede ser firmado por el adulto en el lugar de la vacunación. En algunos lugares de vacunación, incluidos los administrados por el Departamento de Salud Pública, los niños menores de 16 años deben ir acompañados de un adulto. No es necesario que muestre una identificación para recibir la vacuna, ni es necesario ser ciudadano de los Estados Unidos para vacunarse. Como puede ver en el mapa a la derecha de esta diapositiva, una red de casi 900 proveedores en todo el condado proporcionará vacunas a niños de entre 5 y 11 años y muchos ya han comenzado a hacerlo. Este mapa muestra proveedores que ofrecen vacunas COVID a niños superpuestos sobre un mapa que muestra la densidad de niños en este grupo de edad en todo el condado. La mayor cantidad de niños de 5 a 11 años vive en las áreas sombreadas en verde más oscuro, mientras que la menor cantidad vive en áreas de colores más claros. Los proveedores aprobados, incluidos los centros de salud calificados a nivel federal, los sitios del condado, los hospitales, las farmacias, los consultorios de pediatras y de medicina familiar y las clínicas se muestran en los marcadores multicolores. Queremos señalar que casi todos los centros de salud que reciben fondos federales ofrecen vacunas pediátricas y se incluyen aquí en múltiples categorías, incluidas clínicas en lugar fijo, sitios de equipos móviles o los sitios de vacunas para niños. Por esta semana, recomendamos a los padres que llamen con anticipación a los proveedores que figuran en el mapa para asegurarse de que hayan recibido las dosis pediátricas y pueden ofrecer vacunas a los niños de 5 a 11 años. Los 6 sitios comunitarios del Departamento de Salud Pública ya han comenzado a vacunar a los niños y los padres pueden traer a sus hijos sin cita previa. Como puede ver, hay varias áreas en los valles de San Fernando y Antélope y en el centro-sur de Los Ángeles, donde la cantidad de proveedores no es proporcional a la cantidad de niños que podrán recibir las vacunas. En estas áreas, nuestros equipos móviles de vacunación trabajan arduamente para complementar las vacunas ofrecidas por los proveedores existentes para que los niños tengan fácil acceso a nuestra protección más poderosa contra el COVID. Los sitios de vacunación en las escuelas forman otro pilar de nuestro plan de vacunación. Muchos padres han solicitado que ofrezcamos vacunas a niños y adolescentes en las escuelas porque son lugares familiares y de confianza. Las clínicas de vacunación escolares ya han sido una parte importante de nuestra estrategia de vacunación comunitaria. En el transcurso del mes de noviembre habrá 480 eventos escolares en los que se ofrecerán vacunas a los niños, incluyendo escuelas en áreas de alta necesidad. Esperamos que con muchas oportunidades para que los niños reciban la vacuna COVID, los padres se encuentren en un sitio donde ellos y sus hijos se sientan cómodos para recibir la vacuna, así estar completamente protegidos antes de las vacaciones de invierno. Next slide, please. Como recordatorio, hoy entra en vigor la orden de nuestro oficial de salud que requiere que todos los clientes o empleados presenten el comprobante de vacunación completa y una identificación con foto para ingresar a bares, cervecerías, lugares para catar vino y licor, clubes nocturnos y discotecas. A partir de hoy deberá estar completamente vacunado para estar en las áreas interiores de cualquiera de esos establecimientos. Los hallazgos preliminares de cumplimiento para el fin de semana del 23 y 24 de octubre indican que el 90% de los bares y el 100% de los clubes nocturnos y discotecas visitados cumplían plenamente con la orden del oficial de salud, que en ese momento requería la verificación de la vacuna de al menos una dosis. La próxima semana, el 8 de noviembre, entrará en vigor el programa de verificación de vacunas de la ciudad de Los Ángeles llamado Safe Pass LA. Y requerirá prueba de vacunación completa para ingresar a las partes interiores de restaurantes, bares, cafeterías, cervecerías, sitios para catar vinos, gimnasios, spas, salones para el cuidado de las uñas, peluquerías, cines, centros comerciales y lugares de entretenimiento y recreación. Esto incluye las partes interiores de las instalaciones de la ciudad, como el edificio de la municipalidad, los centros para personas mayores, los centros de recreación y los centros de servicio. Trabajaremos en estrecha colaboración con la ciudad de Los Ángeles para educar a las empresas y a los residentes sobre los requisitos del programa Safe Pass LA. Durante el próximo mes y la próxima semana presentaremos un programa virtual de capacitación y certificación para las empresas de la ciudad de Los Ángeles. La administración del presidente Biden anunció que el 4 de enero es la fecha límite para la vacunación completa de los trabajadores, incluidos todos los empleados y contratistas que trabajan en las instalaciones de atención médica financiadas por los centros de servicio de Medicare y Medicaid, incluyendo aquellos que no están relacionados con la atención de salud. Estas instalaciones pueden otorgar ciertas extensiones médicas o religiosas a los empleados, pero los empleados no tendrán la opción de proveer resultado de la prueba diagnóstica ante la carencia de vacunación. Ayer la administración fijó el mismo plazo para la vacunación completa de los trabajadores en las empresas con más de 100 empleados. Las empresas pueden ofrecer a sus empleados una opción que incluya pruebas de rutina y uso obligatorio de la mascarilla. Todos estos mandatos específicos tienen como objetivo garantizar que en las instalaciones de salud, los lugares de trabajo y los espacios públicos, donde el riesgo de contagio es mucho mayor, todos estén completamente vacunados. Con vacunas potentes y seguras, esta es la forma más segura de reducir rápidamente la propagación y permitir una recuperación económica continua, rápida. A diario, todos cumplimos reglas que afectan nuestras elecciones personales. Debemos usar cinturones de seguridad, usar cascos cuando vamos en motocicleta, no fumar alrededor de otros, seguir las reglas de tráfico, cumplir con las normas de seguridad y registrar las armas de fuego. En los lugares de trabajo, algunos de nosotros estamos sujetos a pruebas rutinarias de detección de uso de drogas. Y como condición de empleo y para asistir a escuelas e institutos de educación superior, debemos vacunarnos contra ciertas enfermedades contagiosas. Independiente de quién haga las reglas, todos debemos seguirlas y enfrentar las consecuencias cuando decidimos no seguirlas. Ninguno está exento de cumplir las reglas. Más bien, estas reglas son parte del contrato humano que todos debemos aceptar. Next slide, please. Otra estrategia importante para prevenir un aumento significativo de casos durante este invierno es planificar reuniones seguras para celebrar las festividades. Para este Día de Acción de Gracias, que es en 3 cortas semanas, es mejor si van a vacunarse todos los que están aprobados para recibir la vacuna. Si esto no es posible, les recomendamos que permanezca local hasta que todos en su casa estén completamente vacunados y si es posible, se reúna al aire libre. Mantenga las reuniones con pocas personas y si hay presentes personas no vacunadas o de alto riesgo, use mascarilla en el interior cuando no coma ni beba y al aire libre si hay mucha gente. En estas situaciones también es una buena idea mantener una distancia entre las personas que no pertenecen al hogar mientras come, especialmente si está comiendo en el interior. Y si es posible, haga que los invitados verifiquen que recibieron resultado negativo de la prueba antes de reunirse. Todos queremos estar juntos durante las festividades. Tengamos en cuenta que para hacerlo de manera segura, aún tendremos que considerar algunas modificaciones de seguridad pequeñas pero importantes. Ninguno de nosotros quiere que el enfermarnos, resultar hospitalizados, ponernos en cuarentena o aislarnos debido a que estuvimos expuestos, nos arruine la celebración de Acción de Gracias y los planes de vacaciones de invierno. Muchas gracias.
Thank you so much, Monica. And thank you to everyone for attending today. If you have any questions, please be sure to send us an email at media@ph.lacounty.gov. We will see you next week on Friday. Thank you.